All right, so when you're entering information about an admission, when you begin, you're going to begin at the very top of the screen where the 4 info cards are. And whichever piece of information the owner or RDVM or whoever you're speaking with begins with, you just simply need to begin in that area by clicking on the green plus icon. And then you'll begin filling in that person's information. So in this case, we chose owner. The owner's name in this case is Whitney Whispers, and you'll notice after I tab off of the first name cell, the first piece of information you put into this area, you'll begin to start seeing matches on the right. So the matches on the right are other clients in the system. So if this client's been seen before with any of other patients, then you may begin to see that individual pop up in this list. And you'll notice that the Whitney in each of the matches is highlighted and the client type as client because those are the 2 pieces of information you have in that field. And as we begin to type more information into the system, if there's matches in the system, those will also highlight in red and rise to the top. So, and so forth and so on. Once you realize that you have a match off to the right, instead of continuing to type in everything again, you can simply click on that cell, or excuse me, that card, and it will pop the information into your admission. So notice there's a screen refresh that's happening, which you can see by the little percolator at the top. And now you'll see we have Whitney Whispers in as the owner of this particular patient that we're prepping for an admission. Now, if she goes in and tells me that Toby is coming in for a visit, I can begin typing Toby's name in here, but notice that there's now a list off to your left. So the list on your left is actually matches for the information that you already put in. So in this case, Whitney Whispers has been in our hospital before, and these are all the patients that have been seen in our facility that belong to her. You'll notice I have a Toby in the system already. So if I'm not sure if this is the same Toby or not, because sometimes even if you ask a client if they've been in the hospital before, or if they've referred that patient to our hospital before, they may not remember having done so. Or it may even be that their referring vet has begun a referral before, and for whatever reason they chose not to bring the animal in. So if you're not sure, you might want to start by clicking on the Toby that has been begun before, and then you could actually go in and ask the client, okay, is Toby a miniature poodle? Is he black and white? Is he approximately 5 years old? 5 years, 4 months old? The weight, etc., birth date, etc. If that is Toby, then you just proceed with the rest of the RDVM and clinic information. If that's not the same Toby, and yes, we do have those clients from time to time, as you can imagine, that for whatever reason either have more than one pet named the same thing, or pet's deceased and they have a new pet and they name the new pet the same name. For whatever reason you need to change it, there's a simple change option on each of these cards that allows you to change the patient or the client, etc. And then you just go, it takes you straight back to the same screen, and then you just begin to type that information in. So let's say the Toby she's bringing in is a bulldog, an American bulldog. And, oops, a black and white one, that's male neutered. We'll say this one's 2 years old. Weighs 28 pounds, and save that information. Once you hit save, that will pop up into the screen just as it did before. The only other thing, and I'm not going to go back there, but same exact screen pops up. As you type information in, if you're adding a new patient, if there are any other patients in the hospital system that match, you'll see off to the right, any of the matches will again highlight in red and float to the top. So there are cases sometimes where pets are fostered and they're brought in by the foster parents and then later they're adopted. The foster parents may or may not know who adopted the animal, but the animal comes back in the facility. And the nice thing about the VetView system is that it will float to the top when you have more matches. So you may, at some point, if you're the person entering the information, you may say, was Toby ever owned by someone else? And can you confirm or deny this information, especially if it's the same breed and approximate birth date and that kind of stuff. All right, and then you just keep building. So if I click RDVM, I'm going to see off to the left, that there are some vets associated with the client. And if one of these is the primary vet, you can simply click it and it will pop in. If not, you can build it just like you did with the owner and the patient. And same thing with clinic. So these are clinics associated with the RDVM that I just chose. And I can simply select from there. Now, again, you can build new ones if you need to. You can search through the list as well. Now, on this admission, so this is an admission, and basically this is prepping for the episode of care when the patient comes in. So right now, this referring vet is referring to the veterinarian that referred the case to your facility for this visit. Additionally, the clinic is showing us the clinic that referred the patient to your facility. If you look to the right of each of these cards, there's a little icon. And that icon allows you to identify that this referring vet is also the primary veterinarian. So you normally mark this if Patricia Dragon is the vet that attends to the care of this patient on a regular basis. And if so, you simply click the icon. It says, do you want to save changes and make Patricia Dragon the patient's primary vet? You say OK. It will lighten up or color in the icon. And same with the clinic. What that means is that for this visit, you've done exactly what you need to do. But next time when Toby comes in for a recheck, when you set the admission up, when you put Toby onto the episode, it will automatically pop in the owner, the RDVM, and the clinic from the prior association because you listed them as a primary veterinarian. So the RDVM and clinic on the admission screen are referring to the RDVM and clinic that referred the animal to the hospital. And this little indicator right here is indicating whether or not this is also the primary veterinarian for the patient.